They are in Metro Manila. Now, we would like so much to partner with government. There was a mention about trust issues. I talked to our hospital group, and admittedly, that is an issue. It is an issue. In fact, I was surprised that it was. But I guess
It is an issue.
there seems to be some trepidation. Government not exactly trusting the private sector because the perception is you're in the private sector and gusto mo lang kumita. But let's face it, private business, they go into business obviously to make a profit. Sino bang matalinong negosyante or businessman papasok sa negosyo, go into a business to lose? Now, obviously, no, of course, we go into the hospital business thinking that we can profit from it. But by allowing the private sector to profit, whether it be hospitals, whether it be tollways, whatever it is, or infrastructure, if you allow business to do good, it can do good better also to its fellow men. So if a hospital, for example, is allowed to flourish and do good, then it can ensure that for example, the free services that they give for indigents continues. At the same time, you're able to bring in world-class quality equipment, world-class quality training. In fact, one of the visions of MVP is eventually in the future to have a specialization. For example, a cancer hospital, just like the ones in the States. A center for diabetes, for example. And a center or a hospital for children, which we, I think, do not have. So, not to take much of the time, but let me just say that there are plans to go into this. And there are plans to acquire at least 2 hospitals a year as we go.
And you will have charity wards.
Definitely, definitely.
Yes.
Yeah, definitely.
Okay, I'm going to ask Bo about generics, and before I go to the others, I'll also give you a chance to ask because I don't want to dominate all the questions. Okay, but yes, Bo, what about generics? How will you stay alive? There's so many generic companies, some good, some bad.
You are recognizing one of our major problems right now. So we're happy that actually we're part of the group, including of course government, industry, drugstore, retail, that have really made generics become very affordable, popular, and because of that, we've created a very competitive scenario for us. So it really is a matter of surviving for especially a medium-sized pharmaceutical company like ours. I'm just reminded though, that even though we're very proud that because of what we've done together collectively, we've brought down prices for a lot of the medicines, down to 70% of what it was before. It is now available in most of the drugstore retail chains that you have there. Pero pag tinignan natin yung slides, nakikita pa rin natin na out of pocket is still 62% of out-of-pocket still because of medicine. So, ba't kaya ang taas-taas pa rin, yung bababa na ng mga presyo, yung mga margins natin, razor thin na. So maybe also, when I was looking at and trying to analyze that, maybe part of the burden is also because of the specialist culture that we have, bato-bato sa langit, sa aking mga healthcare professional doctors na napansin lang namin na a lot of the doctors continue to prescribe branded medicines, the newer molecules, or sometimes they're not even new, they're just a new combination. Yung kaagad ng i-reseta, alam natin na mas mahal. So siguro yun yung mga nakaka-burden pa rin sa ating mga pasyente na yung ganun out of pocket. So we feel that actually, I personally feel that a part of that overhaul going to primary healthcare may actually solve that problem. If we get away from that specialist culture and we have primary healthcare gatekeepers really looking after and being able to rationalize the use of medicines, I think that will go a long way in making sure that out-of-pocket also starts to shrink. Thank you.
Are there any questions from the audience? Okay, Secretary Marino.
Since the discussion is actually private sector and development partners, allow me to put forward this question to our partners. We in the government almost always have a hard time getting data. Even in immunization, we cannot get the number of children being vaccinated in the private sector. Would you have the commitment in terms of data input and consolidating info so that government can move as one? If you've noticed since this morning, there were a lot of presentations. Did you see several figures, particular figures, differing in numbers, differing interpretations? And I can remember clearly and vividly there were a lot. If we have wrong information, if we have not so reliable data, it does not only make us unreliable in planning, it scares us. Because your investment and the government investment will not move forward as expected. And if I can just consolidate the three questions. We're talking about the private sector development partners, and we are very thankful in all the help that they have been given us. Unfortunately, even though on all instances the intention is good, conflicts can arise. In what way? The human resource is depleted in some strategic areas. I can say it's a maldistribution. But the intention of many partners and even the private sector is to equip our people and our health workers with inputs and updates. Unfortunately, in so doing, all these trainings depletes the communities and the rural areas of doctors and other health workers. We have been appealing, and in the first few weeks I was in office, may I acknowledge Undersecretary Lilibeth David, who helped me a lot in consolidating. So we have a schedule in the DOH. It's like all trainings, all invitations, and all calls, especially for the rural areas, is scheduled only in a particular week, in a particular month, and only on a particular day. That even with this, we get a lot of invitations from private sector, from development partners, from NGOs, civil society, directly addressed to our people. It actually creates chaos not only within the department, but with our relationship to local government chief executives. Because in that every move, DOH is being blamed. And just for an input, because human resource was also tackled, the data was 2015. So for 2016, like the NDPs was increased to, I think, an additional 3,800. And just to add, earlier in my presentation, I presented the Universal Healthcare Implementers and the Public Health Associates. I do hope that the private sector and development partners can also focus on this sector. Because they are nursing graduates, they're graduates of Doctor of Medicine. Unfortunately, they are not yet licensed. The passing percentage of nursing board exam, 40%. Medical boards, 60%. The 40% nursing graduates, the 60% nursing graduates and the 40% graduates of Doctor of Medicine are all there. Their morale being low. We don't not only have to boost their morale, but they're actually a vital population, a vital niche that can actually provide healthcare. DOH is starting it. May we pose that challenge to our partners in the private sector to maximize their potentials. For all you know, you will be their inspiration, so they will pass the next board exam. Because your input will not be academic. Your input will actually be knowledge taken from the roots. Lastly, many has been discussed about HR, but we have a looming problem. There was a lot of lobby before, and I was in Congress at the time. It was difficult to prevent. The midwifery course was increased to 4 years. That is depleting our health workforce, our midwives. You talk about putting up birth centers. How many people are enrolling in the midwifery course now? Because they'd rather take up nursing. The DOH is putting up a lot of birthing centers. Private sector is also investing. But we are looking at the possibility that no midwives will run these birthing centers. And that is something that the next administration should immediately rescind. That is part one. Thank you very much.
Thank you, Secretary. Okay. Do you want a response or we can? Does anyone want to respond? Beaver, the message.
Thank you, Madam Secretary. Those were very good points. And you do have our commitment. In fact, different companies, I think to a different extent, have been partnering with the Department of Health already in certain key areas. One key area, of course, is the registry for information, particularly for family health. We began as a reproductive health registry, but it's now much expanded to a family health registry, which will cover vaccines. And we have signed that memorandum of agreement with your key people, and hopefully in the next next couple of months we'll actually